All right, everyone. Welcome to Access Point. This is episode 3. We're going to be talking with Greg Garcia of Health Sector Coordinating Council, or HSCC. And we're talking quite a bit about this SMART methodology that he's put together. So for those who don't know me, Chip Hughes, Chief Product Officer here at Imprivata. And I've got my partner in crime, Joel.
Hey, Chip. Hey, everybody. It was a really great conversation with Greg. Really happy to have had it. What did you take away from there? What were the highlights for you?
So there's a couple things for me, and I'm curious what you thought. But first, I really like that we have this type of organization, particularly in healthcare. I really like the charter that Greg talked about. I like the fact that this is sort of private. That was interesting. I didn't know that even coming into the podcast. And then I like what they're doing. Look, I even talked about this very briefly on there, but I think understanding sort of your workflows, understanding how that works, charting that out, and then using that to identify your weak spots. It's a lot like what I think of as threat modeling and how that works within an organization. And you sort of have to do it at every single level. And I think what they're doing is really just value back to these hospital systems and sort of kickstarting this process in terms of continuously evaluating risk. So what about you?
Yeah. I think if most people thought about it really hard, it would suddenly make sense that healthcare is critical infrastructure, and that without a really healthy public-private partnership, things fall apart really quickly. So I thought that was really great. It's interesting to hear the sort of headwinds that he talked about, right? Like workforce and technology and resourcing. We continue to see more of that, and reliance on big third parties. At least this month feels like it's the month of big outages from big cloud providers. So really rethinking that whole approach around sort of resiliency, independence, and, like you said, workflow, I think is really useful. For many people involved in this to just sit down and take the time to really think through what that means.
Yep. And, this is obviously a very healthcare centric episode. I think one of the things for us as a podcast, sometimes we're going to do industry specific. Obviously, we at Imprivata are in healthcare, but the principles that he's talking about, and he sort of talked about this too, he's responsible for healthcare, but I think this notion exists outside of just healthcare. And so I think in terms of sort of adaptability for different industries, those sorts of things, this is still a really useful conversation from that perspective. I will say,
Greg himself did the translation from financial services, into healthcare, and finding very much the similar thing. So I think you're right.
I was going to say, we're going to keep it positive, because I do think we had a theme of there's not enough money in healthcare to solve some of this stuff, but I remain ever hopeful and vigilant that we're going to get there. So I think it was a really positive episode. Enjoyed the conversation. Joel and I always accessible. You can find us on LinkedIn, other platforms, and please subscribe, like, and listen. So enjoy the episode, and we'll be talking to you again soon. Thanks.
Welcome to Access Point. Today's guest is Greg Garcia, Executive Director for Cybersecurity at HSCC, and we're going to dig into a powerful new tool called SMARTS, Sector Mapping and Risk Toolkit that Greg and his team developed, that every health organization should know about. Welcome, Greg. Good to have you on the show.
I'm glad to be here. Thank you.
So can you just tell us a little bit about yourself, and especially tell us about sort of the HSCC and its mission?
You bet. Well, I am the Executive Director of the Cybersecurity Working Group of the HSCC. That stands for Health Sector Coordinating Council. And the HSCC, it's one of 17 sector coordinating councils, each associated with a given critical infrastructure sector. So healthcare is considered critical infrastructure, just like telecommunications and financial services and electricity and oil and gas and everything that the public depends upon. And it is designated by the government through a series of executive orders and other policy foundations. Basically says that these critical sectors face any number of systemic threats, natural threats, man-made threats like cyber attack. And it's really up to the owners and operators, that is private industry, that own and operate these critical infrastructure sectors, to organize ourselves around identifying and mitigating these threats, and to do it with government. So sector coordinating councils are at their heart industry organized and managed industry advisory councils to the government. and to ourselves. So that's what we are. The Cybersecurity Working Group is focused exclusively on cybersecurity. We have 480, I think, organizations across the spectrum of the healthcare providers, the payers, the health IT, the medical technology, pharmaceutical companies, public health. We are dealing with what is a shared challenge. That is cyber threats, and therefore it is a shared responsibility. We have to address it in a cross-sector way. By way of background for me, very quickly, again, I've been doing this for 7 years, but I actually ran the Financial Services Council in this same capacity a few years ago by way of the Bank of America, and then before that, Department of Homeland Security. I was the Assistant Secretary for Cybersecurity at Homeland Security under President Bush. So I oversaw this whole public-private partnership between all the critical infrastructure sectors and the government. So I got to see a wide range of these different industry sectors, how they are organized, what are their pain points, what are their core threats and vulnerabilities. And then how do we address them collectively? So I've been at this junction between government policy and industry and operations and national security for well over 30 years of my career.
Yeah, and for those that aren't maybe familiar with the coordinating councils, like what is really the relationship of them with the, it's about this public-private partnership, but like, which sort of governmental institutions do you interact with? I mean, I think there's some clarity that like you also are very much sort of in the private sector and not necessarily run by the government. Like that sort of like all of that relationship, how does that really work out?
Yeah, we are not at all run by the government. We are, all sector coordinating councils are industry organized, industry managed. And there's a government counterpart called the GCC, the Government Coordinating Council. Under this public-private partnership, there are all the federal agencies that have responsibility over a given industry sector. Under this partnership model, they're called the SRMAs, the Sector Risk Management Agencies. Well, who would be ours? Naturally, our SRMA is going to be Department of Health and Human Services, and by extension, FDA and CMS and all of those components and operating divisions, just as Department of Treasury is the primary partner with the financial services sector. Department of Energy deals with electricity, oil, and gas. And it is a partnership. Again, we are the owners and operators in industry, so it is our responsibility. We are the drivers of the work that needs to be done. How do we get more secure and resilient? And in our advisory capacity, we are advising the government. What can the government do, whether it's policy or programmatic, grants and other kinds of initiatives? What can they be doing to enhance the security and resiliency of the sector? Yes, they regulate, but regulation alone is not going to deal with some of these ongoing and complex challenges, nor will market forces alone. So we don't just stiff arm the government and say, we got this. No, we don't got this. We really need to be working together cooperatively with the government, while of course being in compliance with whatever regulation. But we can tell them, if you have this regulation, it isn't actually going to necessarily improve cybersecurity. So let's talk about what's the optimal policy solution to security and resiliency of the critical infrastructure sector that we're dealing with.
Yeah, and so that puts you in a really interesting perspective to sort of see both sides of that. So, in that position that you take, like what do you see as the sort of headwinds for, particular cybersecurity, but the headwinds for, the health sector?
I think it's been kind of the same throughout the last number of years. What we have is constantly evolving technology, the digitization of healthcare. Everything is connected. Devices and data, and so that when you have a widely expanding digital foundation for healthcare. That means that you have widely expanding points of vulnerability. So that's number one. You have an exponentially growing number of vulnerability points across a very complex healthcare system of all of those subsectors that I just mentioned to you. So you have all of these interconnections and interdependencies. And that level of complexity is going to be a field day, I think, for a lot of adversaries who can poke around and find lots of openings. The next headwind, of course, is resource constraints. So I came from financial services before this. Now, naturally, the big banks have tons of money to deal with cyber threats. Some 10 years ago, I think it was JP Morgan announced that they were committing now $500 million per year just on cybersecurity. Imagine that. There's no hospital, no organization anywhere in the healthcare sector that's committing $500 million a year to cybersecurity. And then take that down to those small critical access rural hospitals across the country. They are operating at best at 1% to 2% margins, most likely at zero, and very often at negative margins. And they're making choices between complying with some security regulation and all the costs that go with that, or hiring a nurse. So you've got technological innovation, you've got resource constraints, you have workforce challenges. You have workforce challenges endemic to the healthcare sector, obviously on the clinical side, but on the cybersecurity side, again, follow the money. If you want to be a cybersecurity professional, is your first thought, I'm going to healthcare? No, I'm going to high tech, big tech. I'm going to financial services. It's where the money is. And we want to be able to say to build a pipeline, a workforce pipeline in healthcare. No, come to healthcare because you are actually helping to save lives. That's pretty cool too. It's technological innovation and resource constraints, workforce. Those are probably the big three.
The scariest part about that whole thing is it's like this never-ending circle too, right? If you have resource constraints, it's hard to go modernize because you want to go modernize. If you don't modernize, you don't have security. You don't have security, then you're exposed. But it's just this constant circle that sort of is self-feeding of big issues that we've seen. So sort of with all of that, talk a little bit about what y'all are doing, how you're going out to address this, some of the new framework pieces that you guys have put together, and what you're seeing on that front.
Yeah. Just maybe picking up on what you just said about the resource issues and innovation. So we published earlier this year a document, a set of findings and recommendations called On the Edge, the cyber health of America's resource-constrained health providers. Basically, what we did is we went out to 30 states, 40 executives among those 30 states, to small rural health providers, to interview them in a very relaxed but trusted setting. How do you think about cybersecurity? Who's managing cybersecurity for you? What are you paying into cyber insurance? What are your cyber problems? And the punchline was the government does want to regulate you more. They want to put more requirements on hospitals and clinics and just health providers generally. That's coming down the pike. We've seen the HIPAA security rule, proposed rule. That's going to be another straw on that camel's back of yours. What would be helpful to you as a small rural hospital for you to actually comply with those new security rules? What can the government do? What can the community at large do to support your compliance, to help you be more secure and resilient? It isn't enough for the government to just go ahead and drop a regulation, wash their hands, walk away. We took care of that problem, didn't we? So that was so. The findings from those interviews, I think, were telling, and I will say that I think the one revelation from that is most of them. And these are not necessarily cyber people. These were the executives making resource decisions for their hospitals, and they would say, "We know we have a problem, and we actually know what to do." I mean, there's some basic blocking and tackling. We understand that needs to be done. We just don't have the people to do it. And so it's a workforce problem. And I'm sitting here in a small rural hospital in southern Wyoming. Now, where am I going to get somebody that's going to be able to manage that cybersecurity? Am I going to give it to the nurse down the hall? I don't think so. So that was a major issue. And so we're going back to the administration to talk to them more about what it is they can be doing. If they're going to regulate, then let's talk about actually doing something constructive to help those hospitals. That's just one example. We did just publish the you mentioned at the beginning the sector mapping and risk toolkit. This is all about primarily third party risk management, but it also applies as well to embedded services and utilities, IT, software, resources that can be disrupted. And how do we identify them? How do we measure those risks, prioritize them, and then mitigate them? So we have over, the Cybersecurity Working Group, since we organized ourselves in 2018, we have published, I'm thinking 30 and maybe 32 by the end of the year. Publications, most of them best practices, guidance documents, recommendations to the government. They're all available for free. They're by the sector, for the sector. Your listeners can go to healthsectorcouncil.org and look at those publications, download them, implement them. So we can talk more about any of those other publications you're interested in.
Yeah, what was the impetus for your SMART initiative? I know, was it something that changed in the sector? So I know there's been these dynamics of vendors and sort of embedded sort of business to business meshes where that are part of the current operating fabric of the country. But was there something that changed that said that you had to do this now, or?
Is that an unintentional pun?
Oh, I know. It could be. No, it was not intentional, but it works.
Healthcare. Change healthcare, and I don't mean to throw anybody under the bus. It has become a bit of a household name. But out of that crisis does come opportunity. Unfortunately, it was opportunity at the tremendous and catastrophic costs across the healthcare system. We sort of coincidentally in February of last year, the Cyber Working Group published our 5-year cybersecurity strategic plan from 2024 to 2029. And right in the neighborhood of the timing of that release came the Change Healthcare attack. The strategic plan has basically 12 implementing objectives. It's our to-do list. Objective number 10 was we got to do good cross-sector, third-party cybersecurity risk management. And when the Change Healthcare incident happened, what we understood is that, my gosh, there are so many other critical services, utilities, functions that are digital, electronic, that support the healthcare system. What are those other critical services like Change Healthcare, which, if substantially disrupted by a cyber attack, the impact would cascade across the healthcare system? We need, as health providers, as med tech or pharmaceutical manufacturers, as payers, we need to identify those critical services. Either where are we, as a component manufacturer, as a pharmacy, as a pharmaceutical supplier, where are we in that chain of events? Or where are those services in the chain of events that are supporting my hospital. And so we created, this was the SMART task group, the Sector Mapping and Risk Template task group. And what we did was simply go through what were 17 workflows, critical workflows like retail pharmacy, medical imaging, labs, lab processing, blood supply and distribution, 17 of them. And it's like a board game. You start at this square, which is the healthcare entity, and you take a hop, and and that prescription has to go through. It lands on the prior authorization square, and then the prior authorization square, you take a hop and you go to the pharmacy, so that the pharmacy knows that prescription is coming, and it gets through prior authorization. A discount, so that all I have to pay is my copay. And then I pick up the prescription and the doctor gets paid. Well, that didn't happen because the prior authorization function was disrupted. And so for all of those workflows, we want to assess what are those critical services that would have, if disrupted, could have clinical, administrative, operational, financial impact, material impact that could disrupt that workflow. By mapping these out, we did not name names because every enterprise is going to have their own service providers, their own technology providers, so that you can visualize that workflow that supports your operation or that workflow that you are a part of, and then assess the risk of each one of these functions. What's the risk? Is it concentration risk? Is it geographic risk? Is it simple cybersecurity risk? That third-party service provider is not doing what they're supposed to be doing, yet they are connecting to our network. And then, measure that risk, prioritize it. What's the most material risk that would disrupt administrative, financial, clinical, or compliance issues?
I was going to ask, as you went through that work, one of the questions that come up is, what was that mix of finding sort of gaps that no one had really considered and finding the gaps that everybody knows that exist, and it's just too hard of a problem to get through? Because I know for Change Healthcare, a lot of people were like, the sort of complexity of having a backup clearinghouse, the cost and complexity of that is just like almost impossible, or I have no real idea how to solve that problem. So most people knew that would have happened. So what was that? What did you learn in that process?
Yeah, exactly. I mean, I think what was clear is that, well, first by mapping it out, you're going to have a better sense of where, let's just say I'm a hospital. Maybe I'm a medium to large sized hospital. Map that out. Maybe I do have some leverage over that provider. I have leverage over their cybersecurity controls, or this provider has a data center based in Southeast Asia somewhere. Well, that's just not a great risk necessarily. I'm going to change providers here because now they're US based. Or there are factors that in mapping this out, you can see where you might have some leverage. While you're mapping this out, you also see where you don't have leverage. Just as you were saying, they're too big. You can't change the way they do business. So then the answer is you better have operational redundancies in place. You better be ready for right of boom. Which means you're going to have backup plans. You're going to have a good operational continuity plan and recovery plan. So those are one thing we learned, and the other is just there's a tremendous lack of visibility because of the constant churn in the healthcare industry. This service provider just got swallowed up by a larger one. Well, they're gone now. or you've got consolidation across health systems, which concentrate sources of failure. So, I would say, operational redundancies was something we clearly understood is essential. Understand we have got a lack of visibility across a very complex ecosystem. And increased reliance on outsourced services coupled with workforce capacity challenges. And then everything's going to the cloud-based services. Now, theoretically, that's supposed to be more secure, but one cloud service provider supporting thousands of entities, that can be a single source of failure too. So,
we just saw a couple of major outages over the last few weeks in big hyperscaler sort of cloud services. And it gets you back, right? It's like, okay, the recommendation is sort of, have resiliency or redundancy, but that gets back to the resourcing problems and the workforce problems. And it feels a little circular, like Chip was mentioning.
Time is a flat circle from that whole thing.
But I'll tell you, it was a good process because we had a very good cross-sector base. There were 50, 60 organizations participating in this at any given time, and somebody working for a large lab, for example, would do their best to say, okay, this is how it should be mapped based on our understanding. Some of them were security people, some of them were administrative people, or they're involved in the clinical side of things. And then they would take that draft map back into their organization and they'd shop it around to the right people, those people who are actually involved in that workflow, and say, is this real? Does this map make sense? Is it accurate? Can by visualizing our workflow through this map, can we make informed decisions or informed assessments about relative risk and backup opportunities, redundancy opportunities. So I want to emphasize, though, that these maps are living documents. We hope through usage, through implementation, we're going to get really useful feedback that will allow us to refine these maps over time to make them yet more useful as a third-party tool.
Well, and I think the thing I was most excited about when I just sort of saw them, I was in consulting for 10 years, and quite frankly, you would pay consultants sometimes to come in and just build that map, that initial map. And this is such an accelerator for, this is what we think it looks like, to your point. Let's go. As that first step, I think the way you're describing it, make sure that this maps to what we think we're doing. And what I'm hearing you say is may not be perfect, but it's at least a great starting point for my organization to accelerate. I think the thing that I'd be interested on that is, not all hospital systems are the same. You've got really, really big hospitals, and you have, these tiny little clinical units, to your point, that rural out there. So can you sort of describe how does this framework, how do you implement it differently based on hospital size, the different characteristics of the different hospitals? How do you think about that?
I think all of the maps should be looked at as scalable. Again, these are templates. So this is not, we can't possibly cover all the permutations within, a retail pharmacy map, for example. Both in terms of complexity and the range of service providers. So that's what we want to hear back about. Were you able to take this map? Yes, this would not replicate your workflow or your place in the workflow. But is it enough of a usable template that you can tailor it to your specific situation? That's where it's just almost it's not just a workflow, it's a logic flow. It's a process of thinking about all the pathways and all the stops along the way. And that should be, I would hope, that would be useful to everyone, whether you're a small organization or you're a larger organization. The smaller ones are just, they will have the challenge of being able to pay, to have the resources to do that. And that's partly, if they can do it themselves, or if not, we emphasize that these maps, we talk to our advisor members, our consulting firms, our security companies in our membership. Say, go take these maps and monetize them. If you have clients that you think would benefit from your oversight and support in implementing these maps, take it, monetize it. You can build a business, a consulting business around these maps. These aren't copyrighted. These are open source. And in that way, I hope we get a force multiplier effect, that those who are there to help some of those smalls, as we call them in short, can use this as perhaps a more standardized or uniform approach to how to do that third-party risk management, which is complex and costly otherwise.
So how are you thinking about, how do you think organizations should be thinking about success? So I use the maps, I go through the process, we want to measure ultimately impact, we want to put together SMART goals, those type of things. Sort of, what's your advice to the hospital systems that are out there?
I guess two things. One of them is success is no surprises. I think a lot of people were obviously surprised by Change Healthcare, because who had heard of them before? You don't hear about it until it goes dark on you. And even more to the point, there's just one of, hundreds or thousands. I talked to one of our hospital systems. He said, we don't use Change Healthcare, but the service provider that we do use uses Change Healthcare. So we got hit on a second order effect. That was a surprise. So if you go through this logic sequence, this workflow sequence, and really tap into who's providing this service to us, and their third party. Well, what about the fourth party? That starts to get expensive. Third party, fourth party, nth party, to know who is supporting your service provider. But theoretically, you have that capability when you can use these maps to visualize. And I guess another measure of success is just being able to accurately measure materiality. I mean, materiality, you have to assess each of these risks according to their potential material impact. That is, their disruption would cause clinical, financial, operational, or regulatory impact or jeopardy. And you can put dollar values to that. So if you go through that process and you can assign that level of material risk based on dollars or based on patient care, care that's disrupted or canceled. I mean, there's a lot of different measures, of course. But that's up to each organization to consider what success means to them based on that materiality test.
So if we're all bought in, which I think this feels really great, how do people get involved? Like you talked about feedback and wanting feedback into these sessions, like getting access to the materials. Like any of our listeners here, like how can they get involved in this? How can they help you along in this mission of securing our health sector?
Yeah, great question. Well, there's sort of two pieces on the SMART itself, but then on the broader Health Sector Coordinating Council. You are a qualified voting member of the cyber working group, essentially if you are regulated, right? You're a covered entity or a business associate under HIPAA. You're regulated by FDA as a med tech or a pharma. You're a plan and payer subject to HIPAA. You're health IT. subject to interoperability rules for information exchange or public health. That's the core of our member base, and all are welcome. We do have 15% of our membership, it's capped at 15%, are the advisor category. They're not regulated. They're consulting firms, law firms, security companies, but they have good expertise in healthcare and cybersecurity. So we invite, certain companies in that category to join us. But for the SMART resource itself, you would go to healthsectorcouncil.org /smart-toolkit. And if you didn't get that, you just go to healthsectorcouncil.org under cyber practices. You can just do the search for SMART, and it comes up. So how you get involved is to download that document. It's a fairly easy read. I don't know. It's about 40 pages or so. Most of the text is simply, here's how you use these maps. Here's how you assess cybersecurity risk, et cetera. But then request, if you are a legitimate bona fide healthcare organization with a quote need to use, then you can request the actual maps, the ones that are filled in, from us through the website. When you download the document itself, the maps are there, but they are all redacted. In other words, they're just going to be generic terms like, this box is a healthcare entity. That square is an IT service. That circle is a third-party provider. And everything in between is not identified. So we did this because these are sensitive documents. We don't want to hand out a roadmap for disruption to our adversaries. Yes, this is probably all, public knowledge, and you can Google all of this eventually, but we're not going to be the ones to make it easy for them. So you need to apply for the actual maps. As long as you've got a legitimate email address and a website and you're a real company, we'll send you the maps. And then we want you to use it, and we want you to give feedback. So the document does provide you a feedback email. If you have used it, then tell us what your experience is with it. And, over time, we're probably going to have workshops and invite those organizations that have actually used it. We know because they've contacted us to use the maps, and we'd like to bring them in, either one by one in a trusted environment or in some kind of a workshop, and say what worked, what didn't work, how can we improve this? That's how you can get involved by implementing it and improving your own security posture. And collectively, that's going to help the sector as a whole.
That's great. I know I've taken a look at them. I think they're great. And I encourage everyone to go to the website, go take a look. I think our definition of 40-page light reading might be slightly different, but outside of that, not encourage people strongly enough to go
in the age of TikTok and stuff. It's like 30 seconds of content is too long.
That's right.
I'm not going to do a smart dance for you guys. I'm not going to do a smart dance.
Well, hey, Greg, this has been really great. So thanks so much for joining us. Like I said, I've enjoyed getting to know you a little bit here and this good work you're doing. So thanks for joining, and everyone go look this stuff up. It'll really help you from an organization perspective. It's a great
Thank you. Yep. Put it to work.
All right. Well, thanks everybody. Thanks for listening. Don't forget to subscribe, share, and follow Access Point on your favorite podcast platform. We also welcome your feedback. Please send us any thoughts, insights, or suggestions to accesspointpodcast@imprivata.com or find us on LinkedIn. Until next time, I'm Chip and he's Joel. This has been Access Point.